Hey everybody, I'm Rachel Wall and I am super excited today to be with Stacy Leach, RDH. And I met Stacy at a local event here in the Charlotte area where I was speaking. And I had mentioned the concept of assisted hygiene, and she shared her story with me, and it was amazing. And so I asked Stacy to come here and share her story with all of you. So, Stacy, thank you so much for being with us today.
You are very welcome. Thank you for having me today, Rachel.
Absolutely. So tell us a little bit about your career. Did you start as a hygienist? How did you get into dentistry? And tell us a little bit about you and just your career journey.
Okay, well, Rachel, I'm originally from West Virginia, and in 1999, I graduated from West Virginia University with a Bachelor's of Science in Dental Hygiene. Go
Okay.
Mountaineers!
Okay.
um, and dentistry was something that I kind of stumbled upon. I took a course in high school where I had to shadow somebody in a profession, and I shadowed a hygienist and really thought that that would be something that would fit my desires for the type of lifestyle that I wanted with work-life balance.
Sure.
Shortly after I graduated, I accepted a job in Charlotte. And actually, my first job in Charlotte, I was a hygiene assistant
Oh,
until I
wow.
received my dental hygiene license. So I had some experience in being a hygiene assistant for a few months there. I've worked in three practices primarily. The one that I'm in currently, I've been in for 14 years in the Charlotte area. I love it. I call it my unicorn office. I feel
Oh,
like it just has a great culture. And we have grown from one doctor to three doctors, and we now have a team of four hygienists. And I am the lead hygienist of that team. And I've really enjoyed mentoring the girls and just my ability to hone in on some leadership skills.
I love that. Thank you for
Yeah.
sharing that. So I mean, I think this is probably similar to a lot of hygienists, but yeah, I happened to have a dental appointment when I think I was in community college 1 year after high school, and no real direction, but my mom was like, you got to figure something out. And my hygienist really inspired me, and here we are, like,
Yeah.
30 some years later. So what tell us, this is a little off of topic, but I'm curious to know, what is the difference, or what have you seen as a difference between being a hygienist in the team and then that role as lead hygienist? What are maybe a couple of your responsibilities or something that you do differently than you did before you were the lead hygienist?
I would say that it has encouraged me to really advocate for my team more. It's made our relationship as a team closer because I've been able to consult with them on things that they may need support in, um, and just, encourage them.
Hmm.
And I've always really enjoyed teaching too. I go into schools sometimes and teach kids about hygiene. Some of the newer, younger hygienists that have been a part of our practice, I feel like it has really rejuvenated me to be able
Love
to
that.
kind of teach them things that I've learned. So that role has been something that I've really enjoyed.
I love that. And
Yeah.
I would say, because you are formally in that role, it helps them know they can come to you, right? That's part of your role there in the practice. So where if you didn't have that, let's say it wasn't communicated, right, by the leadership team that you're the lead hygienist, sometimes other hygienists feel like they're bothering you, or even the hygienist that is the one that everybody goes to sometimes is like, oh my gosh, I'm getting worn out by this. But because you have that role, and you've accepted that role, then they know that they can come to you. So I love that. Thanks for sharing that. So,
Sure.
so tell us a little bit about why your team decided to utilize assisted hygiene or get started with assisted hygiene.
Sure. Initially, we started with I call her our Energizer Bunny, our hygienist that is just go, 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 only on Fridays because we were needing an extra column of hygiene to support our patient population. And we were initially utilizing temps, but
Mm-hmm.
we were finding that that was becoming unreliable.
Mm,
There was no shows or
yeah.
cancellations. And so we asked her, would you consider doing assisted hygiene if we gave you a model that worked very well? And she agreed that yes, she would give it a try. And so for about a year now, she has been doing it on Fridays in our practice, and we've seen it work very well. Shortly after that, we went from a hygiene team of 4 to a hygiene team of 3.
Okay.
And my doctor and my office manager approached me and said, do you think that some of the other team would consider doing assisted hygiene throughout the week to make up for this column of patients that we're going to need another hygienist for? And we all talked about it collectively in a hygiene meeting, and we decided that we would give it a try. And so me and one of the other hygienists do it 1 day a week, and then our Energizer Bunny does it 2 days a week. And we've been able to make up for that vacancy without hiring somebody, and it has been a really good thing for our office.
I love that. And then who are the assistants that work with you when you do that?
So we have given 4 different assistants the opportunity to do this team hygiene model. Each one of us have one that we primarily work with, which has been wonderful.
Okay.
Yeah, we've definitely grown a little bit closer together. We feel
Sure.
like we're in the trenches together. And they like it because it's a change for them. Throughout the week, things get monotonous in dentistry, and
Mhm.
they look forward to a day that's just a little bit different.
Mhm.
And so that's how we've decided to do it in our practice.
So these are dental assistants that typically work with the doctor chair side, and 1 day a
Correct.
week they're assisting hygiene, and you typically work with the same assistant every week on that particular
Yes.
day. Okay, I love that.
Mhm.
So it sounds like it's worked out really well for you. I feel like you, based on our conversation previously, you were kind of like pleasantly surprised.
Yes, definitely pleasantly surprised. And I say that because I told you initially that I did assisted hygiene, 26 years ago.
Yeah.
It was not a good model. It was in a Medicaid practice.
Hmm.
I felt like the patients suffered. I felt
Hmm.
like I suffered. It just wasn't done very well. But when you come up with a good model that supports the patients
Yeah.
and the practitioner and the team, it can be a really great thing for everyone.
Yeah. Yeah, for sure. Do you feel the model that you're mentioning,
Mhm.
um, tell us a little bit more about how you use that. I know you alternate days, so you're not doing assisted hygiene every day.
Correct.
But there are some hygienists that do assisted hygiene every day. But what
Right.
is the key to the model that you're using that you feel like makes it work?
Um, the patients are at staggered entry by a half an hour blocks.
Hmm.
Each patient is still in the practice for the same amount of
Yeah.
time and still get the same amount of attention. But
Yep.
I honestly feel like with that, as you said, Rachel, in a class that I watched that you gave, that multi-provider
Hmm.
model, they have more personal attention.
Yep.
And so, we do have 2 less hygiene slots because of staggered entry in that
Sure.
second column. But I feel like we are able to add more things to the doctor's side.
Hmm.
We're able to spend more time in answering patients' questions, and just sometimes even add more to our hygiene schedule.
Hmm.
So, I mean, it works very well.
Yeah, so you're working I would say a fairly advanced model, right? If you're only losing 2 appointments per day, you're working a pretty fast-paced model, but you
Yes.
are very much aligned with you and your assistant, I would assume. And and also you're working with an experienced assistant who's very experienced with restorative as well, so they can just step right in there and explain procedures and that kind of thing. And in this assisted hygiene online boot camp, we do talk about different levels of dental assistants. And I know people that have also been very successful with hiring, assistants that don't have any dental experience. Now,
Mhm.
it takes a little longer, right, to ramp that up, but it is possible. And I think that opens up some possibilities, particularly right now where it is difficult to hire, in a lot of areas, hygienists and assistants. Um, okay, was there any resistance, or like when you first started it, was it a little awkward? Like were there some frustrations? Like tell us a little bit about that.
Yes, I'm the OG at the office. After doing this 26 years, I'd say I was probably the most
Yep.
resistant, at least
Yep.
internally. I just feared burnout.
Hmm.
I feared that that the patient would not be taken care of like they were before. And honestly, when you see patients for 14 years, I feared that Mrs. Jones would be disappointed that I wasn't with her the
Yeah.
entire time.
Yeah.
Um, and then one of my other hygienists, she has two young children who are not sleeping very well, and
Oh,
she's expecting.
oh
And
goodness.
she feared also just being too tired.
Hmm.
But we have found that that has all been a myth if it's done properly. You know, I really enjoy the day that I do assisted hygiene. I feel like I have somebody who's with me, probably the same
Yeah.
experience that the doctor has with
Hmm.
their chairside assistant.
Yeah.
I feel like there's somebody in it with me and we have a common goal, and, we've grown closer because of that.
Yeah. Yeah. I love that. I've worked assisted hygiene as well, and I love just knowing I could depend on somebody. And
Yes.
that if I did need to spend a little bit more time with someone, that there was some buffer there at least, right?
Right.
And it wasn't as much that like, oh my gosh, I know that patient is sitting out in the waiting room, and but this one really needs me. And not that that is eliminated, right? We still have to stay on our schedule, but I'm
Right.
not alone. It's not all on me. And that feels really great. And just being willing to delegate and trust that person. Um, would you say that you in your model, so you're in North Carolina, so in North Carolina, dental assistants with a certain certification can do different things such as coronal polishing. So do you feel like you're delegating as much as you possibly can to that dental assistant? Yeah.
So, um, yes, I really do feel like that I am. And the dental assistant is really enjoying being able to do some of those things as well.
Yeah.
It makes for a different day for them. Now, my assistant currently has only been with our practice for 1 year.
Okay.
She is not a DA2.
Okay.
Um, but because she is so good at the diagnostics
Yeah.
and the administrative
Hmm.
details that we do throughout the hygiene
Hmm.
appointment, I always have felt like I've had enough time to do the things that I need to do with the patient, the
Hmm.
oral hygiene instruction, really spend a good time, amount of time doing a thorough cleaning. Um, and education.
Hmm.
And sometimes those things, when we have to do all of the administrative and
Yeah.
diagnostic things as
Yep.
well, fall to the wayside. So I feel like I get the opportunity to concentrate on what I went to school for.
Hmm. Hmm. So even though in North Carolina there's DA1, DA2, even though and
Mhm.
I love that because you have a mix of levels of assistants that are working this model with you. Even there, because she's able to do so many of those other things, I'm thinking when you say administrative is probably, helping with notes and scheduling the next appointment and taking radiographs and probably intro photos and things like that. So that's really helping in that regard as well. Any specific um, like comments that your patients have made about this that have kind of made you feel even better about it?
Um, I would just say that, we have the right people on the bus that
Yeah.
are our assistants. They enjoy conversation with
Mhm.
a different person. They enjoy interaction with my assistant because she's just exceptional at what she does.
Well, and
So
here,
if you have the right person, I think
yeah,
it really helps.
yeah. Here's the thing too, and this really it this is a mindset shift for a lot of, I would say, hygienists particularly. Is it is good for patients to see multiple providers in your practice. And I know I'm a hygienist, like we get attached to people and they get attached to us, and that's a good thing. However, it can also become a challenge when somebody wants to take time off or somebody wants to shift their schedule around and they're not available maybe as many days, or just something happens, there are changes, or a new team member comes in and they're not as accepted or welcomed in by the patients and the other providers as they would like to be. So seeing those providers helps the patient because now they have experience with more providers than you, right? And maybe they go over to the doctor side and they saw Holly, the dental assistant that worked with you, and they're like, oh yeah, we know each other, and they're immediately comfortable. So that is a good thing. And it is also a really good thing. Just a tip I will say is if you are very if your practice is really in that, these patients only see these providers, I would encourage you to just start doing some little things like if you're walking the patient out, and I'm speaking to, everybody listening, but if you're walking the patient out, to your admin team and another hygienist comes down the hall, introduce them. Talk about your other team members to your patients. Like talk them up, right? Talk them up. Talk up your doctor. Talk up your dental assistant. Talk up your admin team. Like talk them up because that helps patients and it's going to help you ultimately too. If you want to make a change, it reduces that like, oh my gosh, I feel so bad, or just it just gives you more flexibility. Stacy, are there any kind of, as we wrap up, any specific tips or anything you want to share with everybody about getting started with assisted hygiene, or maybe even if they're already doing it, refining it? Anything you want to share?
Yes, I would just say that communication is key.
Yes.
Um, Communicating the day before. We review our charts a week ahead. I
Wow.
communicate with the business team about how this patient has this situation and may not be the best fit on an assisted hygiene
Ah,
day.
okay.
Um, and communicating with your assistant in the morning before and even at lunchtime and
Hmm.
throughout the day, making sure that you have a way to communicate with the doctors the things that you find, so that they don't feel like they're coming in and don't know anything that the
Yes.
hygienist has seen, and then communicating with the patients because this is a change for them. So
Hmm.
when my assistant goes out to the waiting room, she communicates that, hi, my name is Honey, and I'm going to be taking you back to the operatory today, but I'm here just helping Stacy. And Stacy will be in shortly after we do a few things. Or letting them know that, hey, in order to respect your time, we're going to have the doctor come in first and they're
Yeah.
going to do an exam and then Stacy will be ready for you.
Hmm.
So I think just understanding that it's a change for them as well and communicating with them
Yeah.
is a really great tip.
Yeah, I would agree. I would agree in communicating in advance, right?
Yeah.
So, yeah, instead of waiting and them saying, "Well, what? That's weird. Why did the doctor come in so early?" Usually that's after Stacy's done,
Right.
and then they're wondering. But if we communicate with them in advance, then they know what to expect. And like, oh, okay, that happened exactly the way that she said it was going to happen, and it's all good. So,
Yes.
yeah, and I mean, you're always going to have a couple patients here and there that don't accept things, but we're not making all of our decisions based on those couple of patients, right? We're making our decisions based on our goals and our mission, and the vast majority of the patients that will accept this with open arms. So, thank you
Yeah.
so much, Stacy. This was
You're
great.
welcome. Thank you so much for having me. And thank you, Rachel and Inspired Hygiene, for all that you do for the dental
Oh,
community. You're such
thank
a
you.
blessing. Thank you.
Thank you. I appreciate that. All right, everybody, have a great day.